Botox is biologically designed to last 3 or 4 months. What happens is at the nerve-muscle junction, we call it a neuromuscular junction, there's a signal that comes from your nerve, sends what are called neurotransmitters. They're basically like little keys, if you will, that bind to the muscle side, right? They cross the nerve towards the muscle. The key goes into a lock called a neurotransmitter synapse, goes in there, and it basically causes the muscle to contract. Like you think about raising your forehead, you raise your forehead. What Botox does is it has the same key as the neurotransmitter. It goes into the receptor on the muscle side, and it blocks those neurotransmitters from being able to go from the nerve to the muscle. So when it blocks it, you can't move it. Let's say you have 100 receptors, 100 of them get bound by the Botox, there's no movement, right? If you put a little bit less Botox, maybe you'll bind 80% of them. So you have some movement, but not all of them. But guess what happens? The minute that goes in, your body, the muscle, starts recognizing that these are taken, and then it starts going through a process of growing new receptors, fresh receptors that have no Botox in them to bind them. And once that number reaches a certain level, the muscle goes back to having full function. After that, the Botox is essentially worn off and you are starting from scratch. The window of around 3 to 4 months is good place because it hasn't completely worn off, but yet it's almost there, so you take your next dose. But doing it too early, first of all, you're wasting your money, because as long as those are bound, you can't get more Botox to stick in the receptors that are going on there. Secondly, you don't want your muscle to basically have zero movement ever.